Hello friends, my name is Dr. Prashant Meshram. I'm a shoulder specialist in Hyderabad. Today we'll talk about an important topic which is shoulder stretching exercises. These are 6 to 7 exercises which anyone can do at home. It needs minimal supervision and also it will help you to improve the movement of your shoulder. This will help you if you're suffering from frozen shoulder, if you're suffering from an injury of the shoulder which has led to stiffness, or you had a surgery and your doctor has advised you to improve the movement of the shoulder. Please do these exercises at least 2 to 3 times in one day. If it's causing pain and you're not able to sleep in the night, then I do recommend taking pain medication. I also do recommend ice fermentation or using ice packs at home at least 2 to 3 times in a day. And every time you do it, it should be done for 5 to 10 minutes. The first exercise which we can do at home is pendulum exercise. You can start in the standing position and with the help of the other hand, take support and bend over and make sure that your exercise arm is hanging freely in the air. With a gentle push, move your shoulder in front and back direction while keeping the elbow straight. Then with circular motion in clockwise and anti-clockwise direction, repeat the same movements 3 to 4 times. Next is towel slide. In these, you take a napkin or a towel and slowly move it across the table in the front while bending your body. As soon as you reach your maximum, wait there for 5 seconds, take deep breath and then come back to the neutral position. Repeat these for 3 to 4 times. Every time you move, make sure that you increase your movement of the shoulder by a little bit. The next exercise is called as wall climbers, in which you will start in the standing position. Take the hand and place it on the wall or the door and try to move the fingers while going upwards as if you're climbing the wall. As you go up, bring your chest closer to the wall and then turn in one direction like this to open up your shoulder more. As soon as you reach the maximum possible height, stop there, take 3 to 4 deep breaths and slowly come back. While you're coming back down, take the other hand's help to bring your exercise arm down. It is very important not to leave the exercise arm so that it should not fall down with a jerk which will lead to pain. The next stretch is called as anterior capsule or the pectoralis stretch. You will place your exercise arm like this in 90-90 position over a door or a wall and slowly push your shoulder or your chest in the forward direction. Make sure that you do this gently about 3 to 4 times. With the help of the other hand, bring your exercise arm down. If you're not able to go in 90-90 position, you can also do a low anterior capsule stretch, in which standing next to the wall, you can place the hand with slight abduction like this and then try to push your shoulder or your chest in the forward direction. This will help you to open up your front muscles or the front capsule. Next is tricep stretch. Place your hand as shown here in the back of your neck and try to push with the other hand on the elbow. Do this 3 to 4 times. Then next is the biceps or posterior capsule stretch. Take your arm across the body like this and with the help of the other hand, push the elbow in the back. Try to repeat this 3 to 4 times. The next and the last one is called as the towel pull or internal rotation stretch. Here, you're trying to stretch the right shoulder and with the help of the towel which is held in both the hands, try to pull up with the left hand so that the right shoulder is getting stretched in internal rotation. Try to repeat this exercise at least 3 to 4 times. So I hope this video has been helpful to you in order to know and understand what are the simple exercises which you can do at home, which can help you to improve the movements of your shoulder. Please do subscribe my channel if you find this information useful. Please do share it with anyone who is suffering from shoulder pain and who have had a surgery for the shoulder, who has been advised a shoulder surgery, or who have had an injury of the shoulder. I do appreciate your support and thank you for joining me for this particular video and hope to see you soon with another exciting video about shoulder diseases. Thank you so much.